Yeah, it is another pleasure to welcome one of the HIV and AIDS experts who has really worked tirelessly to ensure that the African immigrant community, especially in the US, North America, get real information or hard facts on how to prevent HIV and AIDS. Again, today we are having Mr. Henry Momanyi, who is the Executive Director of Global Health Services. Welcome to the show, Mr. Henry Momanyi.
Thank you, sir, Mr. Bernard, for this opportunity once again.
I appreciate that. At least today you are loaded again to highlight a little bit more on the preventive side of the HIV and AIDS pandemic. So my first question, Mr. Momanyi, I would like you to tell us, as an expert of HIV and AIDS, which areas in early prevention and outreach services in the African immigrant community and people of color, and what intervention do you think is the best way forward for the African immigrant, for them not to get infected or affected by HIV and AIDS?
Yeah, thank you so much, Mr. Bernard, for this opportunity once again. As you have heard, my name is Henry Momanyi. I am the Executive Director of Global Health Services. We are located here in Brooklyn Park, Minnesota. And our agency focuses on early intervention and outreach services on infection diseases and mental health, first aid responder. Yeah, so we have been doing this for some time now in our African immigrant community for about 15 years now. And still, there is some need. The work's not done yet. That's why we are coming every now and again with this opportunity, reaching our people wherever they are to get the facts on HIV and AIDS, on how it is transmitted and on how it's not transmitted. To start with, today I want to focus on prevention, HIV prevention, counseling, intervention. And what that means is when you, as an expert on HIV and AIDS, when you get your clients, that is people who want to be tested, how do you know the position or the level of behavior they are so that you can be able to administer the services? And that's why we are here today to discuss on HIV prevention, counseling, intervention. And before you do anything as a provider of HIV and AIDS, there are some questions you use for assessing the level of behavior in which your client is, so that you can be able to, know what to, how you can tell him to behave or to, to manage his life outside here in matters prevention. And such questions are, for example, what has been the most difficult part of you changing your behavior? That's a question you ask your client when it comes for the services. What brings you here? What brings you here today? When and in what situation do you know to use the condom? How often do they break this condom if you are using it? When are you least likely to use the condom? When do you have the most difficult time in discussing about the condoms? Once you have discussed about this with your client, you have assessed now the level of your client when he or she speaks. And this is part of the education we normally get from our clients, because the clients are, they're in different levels. And this now, they empower you. You get the tool of knowing exactly how you administer the services to this client.
Thank you so much. Well, you have a little bit touched about counseling intervention. So do you believe that through counseling, this is a better approach to ensure that our people get more information or get acclimatized or get prepared, even if they are found later in life that they are actually positive, this can really help them, and at what stages have you actually, can you elaborate a little bit more at what stages do you think the intervention or the counseling aspect really can help people suffering or people who are infected by HIV and AIDS?
Yeah, that's a very good concern or question. Yeah, like I said, the initial stage, the first stage, as a provider, HIV provider, when you get into contact or when a client comes for the services, the first thing you ask is you use some open-ended questions, that the ones that I've already spoken about, to know what level or what behaviors is this client involved in. And after that, it gives you now an opportunity to know exactly the risk, level of the client. And then you discuss now with him. That's when maybe you can go to detail. You start, do you know what is HIV? Do you know how HIV is transmitted? Do you know how HIV is prevented? Have you ever had sex without a condom? How many, people have you had sex with? And how often do you have sex with a condom or without a condom? Do you know the dangers which are involved with when we have sex without a condom? Such discussions is part of the counseling. They will enable you now to talk, later, to tell him, you know what, after they have tested him or her, and maybe then the result is negative, it now gives you a room to do the counseling. You tell him, you know what, you need to use a prevention whenever you have you want sex, and you must have one sex partner. But if you have multiple partners, every now and again, you must use a condom for prevention, because a condom is the best, universal prevention for HIV. Then again, from the discussion that you have had with the client, you will now ask, the level. For example, do you know how HIV is transmitted? And then, if the client is not aware, and then you tell him or her, HIV is transmitted when you don't use a condom, and when you come into contact with body fluids, which are blood, semen, sex without a condom, breast milk with a trace amount of, enough amount of milk. And after that, you also tell him or her how HIV is not transmitted. For example, there is that, stereotype that the HIV can be transmitted through spit or mucus or sweat or tears or urine, feces, or vomit. And when you are discussing all of this is the counseling you are doing, to the client or to the customer that you are attending. And this is very important. It's basic information of which every person, every human being who, needs to have sex must have this fact. It gives you a window to, give him or her the facts about HIV and AIDS, and also to refer the person where he or she can get the resources. For example, the condoms are supplied free. For example, HIV and AIDS, the testing centers, you tell them when you want to be tested, you can come to Global Services. We do education, screening and testing for HIV and AIDS and referral. Or Sub-Saharan Africa, which also does, the same services. Or Arriveness Project, which has got also tremendous, services for African immigrant people. So it is good to encourage people to get tested, and it starts, from getting the facts. Do you know what is HIV? Do you know how HIV is transmitted? And then from there, you can live as long as it takes.
Thank you so much, Mr. Momanyi, for giving us more insight and highlights on how to combat all the progress we have actually made as immigrants to ensure that the HIV infection is basically reduced. And from the statistics you really have, because you really you are someone doing this one every day in your office or in the community. So are we really having a good trend whereby we are trying to ensure that the infection is really reduced, or we are still having some issues which needs to be discussed or covered to ensure that this scourge
Thank
will
you.
continue? Yeah.
Thank you also again, once again, for that good question. I can say that the agencies that are working in the HIV and AIDS prevention outside there, they are doing a tremendous job. But again, the numbers are high. Like this time around, if you go to the website of MDH, that's Ministry Department of Health, HIV, section, you will see there is an increase in HIV, outside here, especially in the African immigrant community. What that means is either people are getting, to understand that, they should be tested and, live as long as it takes, or we are having new cases which are, getting infected. And like I said, according to the Minnesota Department of Health, right now we have got some cases skyrocketing on HIV and AIDS infections, new infections in our community. So we want to encourage our people that HIV is there, but it's not a final stage. It's not a death sentence. Provided you get tested earlier, you are put into care. There are resources there. You can live as long as it takes, a normal life like anybody else, and it will be there for your family, and you can do anything that you want. But again, we want to encourage our people that it is very essential, it is very important that you get tested. Everybody must be tested, and the resources are everywhere now. The resources are everywhere, wherever you go. In our offices here in Brooklyn Park, Aliveness Project, MDH, Benton County, and whenever there is a number there, we can put the number there. You call anytime, you get all these resources. We want to encourage everybody that get tested earlier. HIV cases are increasing outside there, and we don't know, maybe because of some resources were diverted during the COVID-19. Maybe that's the reason why maybe people are not getting more resources. But I want to believe that the resources which are there, they are not exhausted. And now that we are post COVID-19, we want to encourage everybody. We want to encourage everyone. Please follow the normal basic procedure which are given by the CDC and these other agencies outside there, MDH, DHS, and visit these clinics. Go there, get tested. It's important when you know your status.
Thank you so much, Mr. Momanyi, for that wonderful deliberation. We really thank you for finding time to come and talk to us. We'll continue to engage you. We'll continue to have you come to the studio and have this hot topic, hot discussion, so that our people can really ensure that the HIV pandemic is really reduced, or the HIV infection is reduced, especially in the African immigrant community. Thank you very much. And next time, we'll call you so that you can continue. But if you have any closing shot, please, this is your time to make that closing shot. Then we'll be done.
Yeah. Thank you once again. And there is one point that I wanted to put a close. We asked about these numbers that are increasing. We are trying to close in and understand whether, because initially we had stereotypes like stigma, and it seems our people have started listening or listening or understanding and accepting that it is about my life, it is about myself. I need to get to know my status. And I hope that's why we are getting new numbers which are increasing, possibly. And I want to encourage you, as Mr. Bernard said, this is a very wonderful opportunity when we come here, we talk about our community and the resources that are there, and our partners that are working around the clock to make sure that the community is safe and is healthy. I want to encourage everybody. Please, wherever you are, everybody is what? Is a victim. Unless you get tested to know your status, nobody's safe. Before you indulge in this kind of game or sex, it takes people two to tango. So make sure that the two of you are safe. Just come. It's only just a 15 minutes, 20 minutes. You wait until and then you get to know your position. Then you can engage on your activity. We are there anytime you need. We supply even home. We can even nowadays we are supplying the home test kit for HIV and AIDS. Just come and get one. Go home and test yourself. The government has put it so easy. So, stigma is no more. You come, we give you that kit, you go home, you test yourself, and then you keep on going with your life.
Thank you so much.
Thank you once again, Mr. Bernard, for this opportunity, and I hope
Yes.
we will continue having this wonderful discussion on how we can make our community healthy. And thank you once again for that opportunity.
I appreciate your time, my friend, my brother, Mr. Henry, for your insights and your experience in combating the HIV and AIDS scourge. So the best option is we'll continue, and another hot topic is about this topic of you are basically counseling people who are having mental health. That is something we would love you to really find time so that we can continue discussing it in this particular forum, which reaches thousands and thousands of immigrants living either in Africa, in the US, or in Europe. Thank you so much. Till next time.
Yeah.
Yes.
Yeah, we will. Ben, we will. And actually, it's important that you mentioned that I'm mental health first aid certified for adult and young adult and youth and adult. We are trying soon. We will be doing this kind of intervention where the information reaches the white migrant community, because most of the cases that we are having here in mental health
Yes.
is again targeting our audience, the African American people. So next time, please stay tuned. That will be our next discussion. And Mr. Kebuado, thank you once again for giving this community such a wonderful space so that we can talk one-on-one, to our people, so that we can make sure that they know where the resources are and they make use of it in the proper way. Thank you.
Thank you so much, brother. Thank you. Till next time, may God bless you.
Thank you so much. Have a good night.